A warm welcome to all of you, and thank you for joining us for yet another series of chiropractic and physiotherapy, health and wellness. This October, from 12th October to 20th October, is World Bones and Joints Week. And today we would like to actually concentrate on that. World Bones and Joints Week is a week whereby we educate people on bones and joints conditions, how to prevent them, how to manage them, and also how to treat them. So joining me to discuss this is Dion Njogu, a physical therapist since 1982. I should be 43 years. Yeah, she's got quite a lot of experience, and she's also the founder of Chiropractic and Physiotherapy Health Center. Welcome, Dion.
Hello, everybody.
Yes. Also joining us is our chiropractor, Dr. Catherine Njogu. Dr. Catherine Njogu has been a chiropractor for over 15 years and has been in the States for 13 of those years and 2 years in Kenya. Welcome, Dr. Njogu.
Thank you for having me.
So we'll start with 12th October, which is World Arthritis Day. And perhaps we could begin with Dion. Dion, what is arthritis? And the different types of arthritis.
Thank you very much. Arthritis is wear and tear of joints, where you find that the smoothness of the joint is already finished because the smooth part has worn out. There are many different types of arthritis. Even some don't make it like a wear and tear. So the main difference is that there is one which is due to trauma and can cause arthritis, or due to what we call pathology, like a disease or a syndrome which is in somebody's blood, and that is what we call arthritis. So when we talk about arthritis, it's a big list, but the ones people know very much is like the one we call rheumatoid arthritis, which you call it is like autoimmune condition, and then trauma, where the joints have been hurt and they are unable to go back to what they used to be, causing arthritis in that joint.
Okay. Dr. Njogu, what is the role of chiropractic medicine when it comes to arthritis?
To add to what Dion was saying, it's very important to know exactly what arthritic condition the patient has, because obviously, like the most common one, obviously, is the wear and tear degenerative joint process that we can manage with chiropractic care very easily, right? And we'll employ certain techniques that will help with slowing down the progression of the condition, and then we can manage it after that. Course. The other one, which is more inflammatory or autoimmune, that one obviously we then involve, the medical doctors, because obviously there's certain tests that have to be done to measure the severity of the particular inflammatory process, certain diagnostics to see how far it is and how and where it is. And even from a chiropractic standpoint, there's some very limited techniques that we can use to help with the joint pain. And even there, it is going to be more multidisciplinary approach with autoimmune inflammatory arthritis.
Okay.
Yes.
And just before we go to autoimmune, Dion, you're saying that arthritis is no longer, it's not an old people's disease, the wear and tear. Like you're not going to get it at 50 or 60. You might actually get it even as a teenager. Is that what I'm getting?
Yes, like the one Dr. Jog and I are saying trauma. You have been a sports person, especially in football or rugby.
Yes.
You get a lot of injuries. If they go directly to your joints, automatically the joint is affected. So if it is not managed properly, or it had even a fracture, the healing of that fracture will cause the joint to have arthritis. So arthritis is commonly after maybe people who are very active from 21 upwards, they will still get arthritis. You will get somebody who has been playing rugby in their early 30s. You'll find they have arthritis of both the hips, knees, and sometimes shoulders. So you can get arthritis early, which we call traumatic arthritis due to the injuries during the sports. Or sometimes you can have a road accident, which can injure a lot of joints within the body. When they heal, they don't heal like what they used to be before the accident. That way you can get arthritis even as early as even a kid of, let's say, teenage. The other area is where we have bone diseases, something we call like osteomyelitis. If the child of between 6 and 10 gets infection in the bone, it affects the joint movement. So by the time we manage that infection on the bone, it will cause limitation of joint movement due to the swelling and the pain with the child. So you'll find that even a kid of 10 years can have arthritis of a joint.
Okay,
Yeah.
all right. So you spoke about the autoimmune disease, the rheumatoid arthritis. How does physiotherapy come in with rheumatoid arthritis? Yet it's an inflammatory disease.
As Dr. Jogo has said, it is inflammatory
Yes.
condition. So when it is inflammatory, it causes swelling in the joints. And when the joints are swollen, where the muscles and tendons are attached, you will find that there is no movement. Joint movements are limited. There is no mobility. So the person is just stationary. So for us physiotherapists, we come to assist those conditions for them to be able to move as much as they can with the help, because that time they're in swelling stages, they are unable to do anything. So we have to help them to we have mobility in all the joints, so that as the inflammation reduces, they will find the joints are still mobile. So that's our part during that inflammatory stage.
Okay.
Yes.
Okay. Any additions, Dr. Njogu?
Yes, that's very true with what Dion was saying. When you have that inflammation and the swelling in the particular joint area, so don't forget the nerve endings in there as well that don't like the fluid that's produced from those swollen joints. And so, yes, when it comes to that particular condition, yes, physio definitely does help with mobility. For chiropractic, we see where the nerve entrapments are happening, and we actually release those, with very specific type of techniques, which then add to what the physios are doing. So overall, we also not only decreasing range of motion and pain relief as well, but also trying to help the body heal properly in the way it should.
Okay.
Yes.
All right. So I would like to wind down that topic of arthritis and move over to World Spine Day. And World Spine Day is celebrated on October 16th. And this one has got some very interesting statistics. So it says low back pain is a single leading cause of disability worldwide and the condition for which the greatest number of people may benefit from rehabilitation. And it also goes on to say low back pain can be experienced at any age, and most people experience low back pain at least once in their lifetime. Prevalence increases with age up to 80 years, while the highest number of low back pain cases occurs between the ages of 50 to 55, being more prevalent in women. And then there's something called non-specific low back pain. It's the most common presentation of low back pain, about 90% of the cases. Now, this is very serious. It's a single leading cause of disability worldwide and the condition for which the greatest number of people may benefit from rehabilitation. What is your opinion, Dr. Njogu, about this?
Well, it's interesting that they're actually saying this now, because I know when I was in the States and I was working into a greater capacity in the hospital setting for a federally funded hospital group, they recruited chiropractors into primary care because they saw that using the opioid drugs was not helping in and with the low back pain symptoms. It was causing other problems, yeah? So drug dependency and that kind of thing. And even work disabilities, work off, people were taking work off. And so we were brought in as a team, as a department, to more or less mitigate that particular issue. And a lot of what they call principal evidence-based research show that what we do as chiropractors definitely mitigates not only low back pain, but also too from an occupational hazard and occupational health screening can help employers know who to hire, so that way that person, once they've gone through that screening, they can definitely know, okay, if this person needs care first, can go for care first. If this person, through their screening, is able to show that they can actually carry the job of blue-collar work, through that occupational screen, they can actually determine that. So low back pain is not lost on anyone at all. It's a very debilitating condition. And I think the fact that the statistics worldwide are what they are, and of course they're going to vary based on which country and demographic you're talking about. And obviously with the dawn of the workforce that we have now, we're sitting more.
Yeah.
We're not moving more. Yeah. We're sitting behind our desks when you're at work. In the crazy traffic, we're sitting down all the time. We get home, we sit down and watch the telly.
Yeah.
There's not much of a, exercise program that breaks up that tension and that repetitive cycle of sitting down and wasting muscles away. And that's where a lot of those mechanical low back pain things come in. That's number one. Number two, obviously, Dion talked about this in terms of trauma, especially contact sports like rugby and football. That also is an area that you can have a lot of low back pain symptoms, not at that time, but a few years down the road, you'll find a lot of rugby players, football players having a lot of trauma to their lower back. So there's that. And I think also, too, the fact that even for us here in Kenya, where we have our mothers who are farming and who are, bending over and just doing a lot of planting and harvesting, we've had cases whereby they came in with a lot of lower back pain and some of that went into their legs. And by the time we actually even determine what is happening, it may be a little too late to even help them with chiropractic care. So it's really talking about the demographic of clients that we have. Are they working in the office? Are they out in the fields? Are they playing sports? Those are things that now we are trying to see what's causing what and how do we now remedy this situation. Yeah.
Okay. And Dion, so low back pain cases are very common between the ages of 50 and 55 and mostly women. Why would you say it's mostly women?
The first thing I want to add to what Dr. Joga said is that low back pain, if nothing is congenital in one's life, what causes low back pain is what we call poor ergonomic postures. Because for you to have back pain is you did or you do what you do day to day in the wrong way.
Wrong posture.
Wrong postures. If everybody could ask, if I'm digging, what is the best way to dig without affecting my spine or my back? Immediately you take yourself in that position, you will find that you will do your work without having to have back pain. If you are a driver, how do I have to drive properly? A good position which will make sure that my spinal is fully supported so there is no strain on it. The third one is the habit. You will find people will sit in a long way, as she said, when you're watching TV or doing the work at the desk. Ask yourself, am I in the proper posture? If everybody will observe that ergonomic position, whenever you are doing, we shall have no people having back pain. Being conscious of whatever you are doing, you are in the right position. Now to come to your question about women. Women have activities which have to affect the lower back. And when we say lower back, is the spine, which we call the lumbar. And that is the area which is more mobile, most mobile in human being. So the first thing is that when we are teenagers, when the young ladies are teenagers, they have what we call menses. When the uterus contracts, the area which is directly affected is our lower back. So that way, you'll find somebody in her periods, they always have pain on the lower back. Then we go to when they go to age of productivity, getting babies, giving birth, and being active, cleaning, washing, doing the activities of daily living. Them, they will also take the long positions. But that time, they are very strong. Their muscles are so strong, they might not feel it that time. But as we go towards 50, the muscles start losing their strength due to as the age comes. So you find that the abdomen, after being with the babies or due to overuse, it can no longer support the spine at the lower back. And that way it causes pain on the women. So by the time they reach 50, there's no strength to hold the spine. The muscles of the front are all weak and the core is no longer supporting. And that way it affects them because if you look at the anatomy of women, the pelvis is like a basin. It's different from men. So you find that the sagging of our pelvic floor muscles affect the back, lower back of women. That is another contributor. Then the other thing is when we have hormonal changes. When we reach 50, when people are going to menopause, and this menopause or the hormone, which is affecting the hormones, it will make the individual feel laxed, no exercises, nothing to tone them up. So they end up, by the time they are in 60, even stooping to walk. They might say it is the back, but it could be the muscles of the legs, which are already so weak, a condition we call sarcopenia, so that they are unable to support their spine anymore. And that way, the back kick continue hurting for a very long time. And lastly, they are unable even to walk.
Oh my.
Yeah. So it is because of the changes in women more than men, which causes women to suffer from back problems more than men. Yeah.
This is where you become envious of men. Eh?
Sorry?
You become envious of men.
Yeah.
So Dr. Njogu, this year's slogan for World Spine Day is invest in your spine.
Yes.
How can people invest in their spine such that you grow old gracefully without all this issues? Yes,
absolutely. So our profession has had many strong pioneers that really, truly appreciate the spine and the nervous system that is encased in the spinal column, yes? So from our premise, we understand and believe that the nervous system powers every organ system in the body, right? Yes. So to keep up its optimal function, to get more of your health in your life and vitality, one of my peers, who's one of my mentors, just said, think of it this way. If you had a car that was living, right, and you're in this car 24 hours a day, 7 days a week, wouldn't you take more care, making sure that this car that is a living car, that you're in 24 hours a day, 7 days a week, 365 days a year, that is, you're getting more from it because you're taking care of it. And I'm like, of course, absolutely. Yeah. And so he just say, you know what? And in terms of, there's some things I agree with him and there's some I question. But when he said that, even having regular maintenance checks, that's true. The same way you have maintenance checks with your house, with your vehicles, with your motorcycles, with everything else, but especially your body, because your body is your house, right? You don't want your house to have any damages, and then you have to make expensive repairs. And at the end of the day, the house itself is an inanimate object. Yours is living because it has the tissues that function every day, and you function day in and day out. Is to actually check your spine so that you're getting more out of your health and your lifespan, and you're able to do more things because you're getting yourself checked. And majority of my peers globally will say that people who actually get annually, like checked regularly in a year, are the ones who have the most healthiest blood labs.
Yes.
You know, I mean, I've had patients who would go and see their medical doctors for their annual reviews, and the doctors would just say, whatever you're doing, keep doing it. Blood pressures are down, your cholesterols are down, your thyroid organs are working well. What are you doing? And we're like, we're just, it's encompassing, well, spine health, chiropractic treatment regularly, good diet, exercise, good food. Those things definitely add up to a good health. So definitely the World Spine Day is something that I advocate, because obviously, why not? Why not take care of the most important house in your life, which is your spine and your body?
Can't be replaced.
Cannot be replaced, and no spare parts.
No spare parts at all.
Yes.
That's a very good answer Dr. Jogu has said. Because you'll find everybody says, I've gone for medical checkup, my annual medical checkup. You'll go for as blood checks, colonoscopy, endoscopy, all those things. But we have not been having people investing in their spine being checked. You do it all the rest every year. So invest in being checked your spine every year. And if it is possible, twice a year, because it is a car moving every day. So invest there. Don't only stick to medical side, go to bone and joint management, and it will keep you.
Okay.
Yeah.
So there's an argument that even with proper posture, for as long as you're in that position for very long, you'll still get the back pain. What do you have to say to that, Dion?
It's very rare. That one, I think, unless it is something we call pathological. Because if there is a disease causing bone diseases, like there are many. If we list them, there are very many which cause our bones to get sick. And when they get sick, the pathology part of it, they will cause the muscles not to work the way they are supposed to work. But if you have no problem with the bone disease and the joint diseases, and you have proper posture and you do regular exercises or movements, it's not always you have to have a backache. A back will never hurt for nothing.
Okay.
It will always give you a reason why it is hurting. So even if you get backache, just go and consult. You will be able to get the origin of the cause of this backache. Otherwise, backs always complain with a reason.
With a reason.
With a reason.
Okay. So you've had it. Invest in your spine. Observe proper posture. Exercise. Proper nutrition. And get your spine checked once a year, or at least or twice a year. Yes. So we move on to 17th October, which is World Trauma Day. And Dr. Njogu, kindly highlight the kind of trauma that would create problems with your bones and joints, and when you actually need help. Yes.
So in our profession, in our chiropractic profession, we recognize 3 types of traumas. There's the mechanical trauma that we all can agree, any kind of injury to a joint or to a part of the body, either from a car accident, whether it is from falling down, whether it is from playing a sport. Those kind of mechanical traumas will cause, pain, obviously, in that area. If not right away, a few days, a few months, a few years later, pain will show up, right? That's that one form of trauma, which is the mechanical trauma or physical trauma. The second type of trauma is chemical trauma. And they were talking about what the person is exposed to, whether it is either, and this is something that I noticed in the US, is like if you have not the best water sources, or even the soil's not necessarily being giving nutrition to the food, so now you have not the best foods per se, or you're exposed to different pesticides and chemicals. What you're exposed to can also cause some kind of trauma in your body tissues. that obviously, yes, can even manifest in the joints, right? And so there's that component of that particular chemical trauma that we recognize does that to the body. And yes, that part helps, but the other part also too is then helping the person recognize that chemical trauma. What is it that are you exposed to? And then being able to actually help that person to either, number one, get rid of it, or if it's geographic, move somewhere else, right? So that way the body can heal without being exposed to that particular chemical trauma, right? The third and most important trauma that I think that is very underrated, even in the healthcare field, is what they call psychological or thought trauma. So when you're dealing with bereavement, when you've dealt with a traumatic loss of either a loved one in the family, you have what they call psychosomatic trauma. So I'll give an example. So when someone has lost someone that they really love, whether it's a spouse or a child, the amygdala, part of the brain, turns on to fight or flight, right? And the upper portions of your nervous of your brain and cortexes that actually are for higher thinking and faculties shut down. So that's why you see a lot of people who cannot even either talk, who are very quiet after they've lost somebody they love, right? And even grieving can take forever to even get over grieving, right? So then when that happens, from a neurological standpoint...
Hold on. So you're saying, say someone close to me dies,
Yes.
and it comes as a shock.
Yes.
So the body takes that. The response is the flight or fight response.
Yes.
It's like, okay.
And any area of vulnerability in your spine that exists that wasn't symptomatic, now of a sudden becomes, that stress goes there.
Oh.
Yeah. So it could be in your shoulders, could be in your lower back, an area that is prone to a lot of wear and tear, repetitive stress. Once you have that particular trauma stress from a bereavement or even being in a car accident, it could be both physical and emotional because of the severity of the accident. And so that's an area of healthcare that I think doesn't necessarily get much grace period to be investigated because it does affect all of us.
Yeah.
You know, and so that even to itself, even with physio and chiropractic, we manage patients who have had to deal with, separation from a husband, losing either a child or a spouse in a very short time. That takes a while. And that's itself, we recognize from a physical standpoint, we can deal with. But there's also a counseling standpoint. And then also meeting with your spiritual leaders on how you can process that.
It's multidisciplinary.
Yes, multidisciplinary. And I've seen that with a lot of domestic abuse cases in the States, whereby they dealt with the mental part of their trauma, the psychotic part of their trauma, and now they go into chiropractic and physiotherapy to help with now the mechanical manifestations of that psychological trauma. Yeah.
Oh, wow. Okay.
Yeah, it's an area of healthcare that really needs also to be looked at. Because everyone walking around, don't tell me that someone doesn't carry some kind of psychological trauma. We do.
Okay.
Yeah.
All right. And do you want just to talk about now the physical trauma? If I was to get an accident today, or I fall from somewhere, maybe a floor up, or fall down the stairs, and I just do my, normal first aid, or I rest a bit and I'm able to walk it off. Any need to see a physio or a chiropractor and the pain is gone?
Yes, there is always need to do what we said first in your
Spine.
In your spine. Because the impact you got of falling, what you felt was what we call soft tissue injuries. And when soft tissue are healing, they don't heal in a smooth way. They heal with what we call scars. So if a muscle heals in a scar, you'll find that where it is attached, it also shortened that in distance, which means it causes misalignment in that joint. Okay. So after the healing of soft tissue, you need to see somebody who can deal with the bone and the joint.
Yes.
So to check whether the bone went back to where it is supposed to be, or the movement of that joint, is it okay? If it is the back, did it move the joints or the bones of the back such that it reduced the space for the nerve to pass through? Because if you stay with that joint still with a narrow place for nerves to pass, it will cause one day for you to feel numb or heaviness of a leg or an arm, or feeling always the neck feeling very uncomfortable. So even after an accident, soft tissue healed, you must be checked on your joints, spine, and bones, so that you can be back to your normal body.
So those annual checkups are very, very
Important.
key. You can actually capture something in its early
The
stages.
yes.
Okay, all right. So we move on to 19th of October, which is World Pediatric Bone and Joints Day. And Dr. Njogu, perhaps you could highlight some of the issues that kids have and require attention. At what point should a mother go like, okay, no, this is not okay. Let's get this child
Sure.
seen.
I think mothers have and I mean, I'm not a mother, but I can definitely tell you mothers have an innate and an intuition about their children even before they're born on another level. So as a baby is born and as the baby is born, a couple of things happen, especially depending on how the baby is delivered. Definitely, number one, when the baby is delivered the natural means without having CCS, the things that we look out for is how was the baby brought into the world? Did they require extra help to guide it through the birth canal? Did they need a evacuation? So, using one of those main techniques to actually help the baby come out. And then to also check and see how's the baby, how's the spine alignment with the baby, Do they have a blockage in their brachial plexus, which then leads to Erb's palsy? So when you have a dropped arm or it's not really moving well, or even is the baby's head turned one way, that's torticollis, right? So even just having that initial check a few days after they're born can help, number one, help the mom kind of more or less settle down a lot easier. And also too, with the baby being that small and that's new, of course, to the world, can give them also too a chance to help direct their development properly, because those things will come up, kids who are colicky, that's a thing. Children who actually either they start teething and they start getting ear infections, those are things that happen. Or even you just notice that that my child isn't walking properly and they're not necessarily processing their primitive reflexes that they have. Those are things that both chiropractic and physiotherapy can really help the baby integrate those things as they develop their gross motor movements, and they also help develop their different milestone cues that they need to be fulfilling, and help the baby even just not only just survive but thrive. Because some children may not necessarily even be able to crawl before they walk, and you have to crawl first before you walk, right? Hopefully after you walk, you run. Yeah. After you run, you fly. Right?
Well, we get to get there.
I'm just kidding. No, but there's a process
of
that gross motor development skills that the baby has to more or less fulfill, and the mom can tell there's something wrong with my child, and that's where we can come in and help. Know how we can help the baby and help with that process. Okay. We have many children who come here for physio and also for chiropractic as well, and the parents have seen tremendous outcomes, and that's because the babies' bodies have a high metabolism, so they can actually heal much more fast and process things much more quickly.
And adapt faster.
Yes,
okay.
Absolutely, yeah.
Right. Okay.
Which I'm envious about because. But that's what it is, yeah.
Okay. So Dion, let's talk about teenagers and the growth spurts. What kind of conditions could occur there, affecting the bones and the joints, and they actually need to see specialists over that?
I would talk about the two conditions which really affect teenagers within joint and bone disease. when a teenager, especially boys, they grow so fast. They find that their bones grow faster than their muscles. So what happens is that you will find them saying whenever they play, they have pains, or especially the knees and sometimes the hips. It's a condition called the osteoporosis, very common to the age between 10 to 15, where the growth hormone is so high. So you find that the muscles are so shorter than the bone. So it will put pressure on the bone such that the pain on the bones becomes very severe. It is a case which is manageable by both the, especially physiotherapy and the chiropractor. That is one common thing with the teenagers. The other thing is more common to girls. Due to the same growth hormone, you will find that the spinal column will grow more on one side and the other one is left behind. So you find that the person gets what we call scoliosis. Yeah? One side of the spinal column growing faster than the other one. That makes the person to get turned to one side or even grow in a different position. And it can affect the lower back, the chest, and sometimes a part of the neck. So those are the most common conditions for teenagers when they are growing. But they are manageable if they are noticed early enough. So the only advice I would tell the parents, whenever you hear a child from 9 years saying, after I do sports, my knees are hurting, don't ignore the child. Check with the doctor. They can take an X-ray and check what is happening up to 15 years. After 15 years, the growth hormone starts to reduce, and there is that way. For girls, make sure that you check them when they are dressing, because if you tell them they go to tie their shoes, you will see the spine. If there is that issue, the spine turns when she bends over, which causes now the thoracic, the lumbar to be always twisted. And that's something can be corrected before they are 15 years old. So it's always good to check on the teenagers, especially for those two. Otherwise, the other one is what we call, which is very rare. It's where the groove, we have our legs, which has two bones. That is the thigh bone and the lower bone. When they are forming, sometimes the area for what we call kneecap becomes smaller than in normal in the teenagers. So you'll find that they keep on, whenever they are running, they keep on falling without them wanting. It is because the locking of the two bones by the what you call kneecap, the place is very shallow and that it can't knock it properly. That is also very common to teenagers, and as they grow, they also get frustrated to understand, haven't they done anything? And have fallen. Just a bit of anything, you fall off. It's not their fault. It's the groove between the two bones where the kneecap is supposed to rest, which is very shallow, so it doesn't allow the other areas to lock properly. So that is the three areas where I find with the teenagers with the bone and the joints.
Okay.
Yes.
All right. So Dr. Njogu, in a previous edition, we did cover scoliosis.
Yes.
And how to check for scoliosis. But there's one thing that we keep coming across, especially when we go out and do the medical camps, is flat-footed people.
Yes.
So some are born with it. And at the point that they are growing, is there something that can be done to help the person get the arch, or how can flat-footed people just because they end up having a lot of low back pain?
Yes.
Because of flat feet.
Yes.
So perhaps just highlight that and maybe whether it can be corrected.
Absolutely, yes. It's obviously at first, babies are not born with pronounced arches, of course not, no. But over time, as they're bearing weight and they're trying to walk, the arches come in, right? However, when with having flat foot, that obviously the mechanics of the foot actually determine how the person walks, and also to where the hinging point in the lower back is affected because of the flat-feetedness, because our feet are like a tripod, right? You have the big toe, the small toe, and then now your heel. If there's not an arch that supports you there, then obviously that you have to make up for that particular translation of ambulation somewhere in your back, right? So one thing we can actually do is with children, definitely you can check and see how they're, number one, not only walking, and also check their feet and also check their arches. They're definitely, they're children who are also born with clubbed feet, so they're more turned inwards. There are obviously orthopedic ways to actually help with remedying those things with physiotherapy, chiropractic care, but also with putting in some supports or some orthoses that can help with that. That's for club feet. But for flat feet is to more or less monitor and see how the child is walking, where the hiccups are happening, and also train them to actually see how they can walk properly. After that, then obviously as they walk more, those arches develop. If it hasn't developed after a certain point, then we involve pediatric orthopedic doctors to actually help us then put in some kind of support into the foot, but also train the child and train on how they can actually curl their feet up. That's one thing. The second thing too, in terms of not only with pediatrics, but also too with adults who do have that flat-footedness, is to actually give them some kind of support to help more or less with establishing that arch in there. And obviously treating and monitoring them as they're wearing those arch supports, and to the degree that they can and where they are in their life, train them on how they can actually even be able to curl their feet in by themselves. So having that support there while training them to help develop those arches, to help with their walking and their ambulation, number one, will not only take care of the lower back pain, but also to take out any muscular disarray that happens because of that as well. So we can definitely help with them, but it's also one of those things whereby you also involve, where you can, either a good podiatrist, an orthopedic doctor too as well, to help with the case-by-case situation.
Okay. Interesting. So we can move on to the last day of the week, which is 20th October. And this particular day is World Osteoporosis Day. And osteoporosis is known as a silent disease. Dion, why is that?
Maybe I will give Dr. Jog the chance to talk about it before I enter in.
Okay.
Yeah.
It's called a silent condition because I guess, one, our spine is not something that you see. It's not like you can actually open the zip. There's a zip on your back to see how a person's spine looks like. And I think also to the appreciation of catching it earlier based on many factors. Number one, and so this very well with when I was in the States, certain demographics will have early onset of osteopenia and osteoporosis based on their diet and based on just how they live. Secondly, too, with osteoporosis, it definitely affects women in menopausal, postmenopausal.
Maybe we could first define osteopenia and osteoporosis.
So osteopenia is when you start having... you're starting to see, that on radiologically on an X-ray, you see that the bone density is not exactly as robust and as sharp as someone who has a healthy, what they call opaque bone. Not so opaque, but you can tell the difference from an X-ray. And the osteopenia is a precursor to osteoporosis, right? So osteopenia is where is the beginning phase of osteoporosis, and that affects not only just women, but also to men as well to some degree. I've had clients male patients who've had osteopenia. And there you can definitely say, okay, you confirm that with lab works and see if they have do they have their vitamin D levels up? Are they deficient in minerals? So you can actually address that problem with diet, but also with exercise as well.
Yeah.
So osteopenia is telling you, watch out, if you're not careful, you can go to osteoporosis, yeah? And even osteoporosis to itself, that is not common in women, but it's in men, could also be from certain other conditions and some certain other situations. But specifically for women, as we get into menopause and our estrogen levels and progesterone levels drop, those particular two endocrine hormones are very important for bone mineral density. And even how our muscles, the integrity of our muscles and our joints and ligaments. So when we start getting that drop in those hormones, and we're not getting enough binding of vitamin D and minerals, then we start seeing osteopenia and osteoporosis. And when you find osteoporosis, that also has to be not only diagnosed by X-ray, but also to what they call our DEXA scan, to see which part, is it early onset of osteoporosis? Is it severe? What do we do? And then medical doctors can actually recommend what the patient can do.
Okay.
So with osteoporosis, obviously, as with chiropractic care, we are very careful in terms of how we treat osteoporosis.
Oh, because the bones are brittle.
They're brittle.
Yeah.
And we cannot use any mechanical high velocity, low amplitude, force to put joints in alignment. And even there, you also have to make sure that they're following up with their medical doctor as far as what protocols they're going to use to actually help remineralize their bones the best that they can. Yeah.
Okay. So, Dion, perhaps we talk about nutrition for the bones and joints. What do we need to make sure is in our diet as we grow older so as to avoid things like osteoporosis, osteopenia?
You see, the one, as you said, that osteoporosis is a silent killer. Osteoporosis is really the inability of the body to absorb what is necessary for the bones. It's not something you have done or you have not done to be able to have brittle bones. You'll find a young man of just 30 years, 40 years with osteoporosis. And he is eating properly, he is exercising very well, but you find the body itself is not able to absorb the bone material depositing in the bone. So it is something, as Dr. Jogu said, it's something chemical. Not mechanical, but chemical within the body. That is the main cause of osteoporosis.
Okay.
Now it becomes more prevalent in women because during our hormonal period, that is between when you become to puberty until menopausal, we lose a lot of that ability of absorbing the bone materials from the food we eat to the
What's
bones.
the calcium?
It's not only calcium, there are so many things to be involved.
Yeah.
So, because for women, as they grow older, you'll find at the joints of their hips, mostly the hips they have that osteoporosis and they can break easily. You'll find the long bone is okay. But when you go to the joints, they are already very brittle and they can break easily. The others, it concentrates on the spinal column, where the bone of the columns the small bones of the spinal column become very brittle. They are very transparent. They are very weak. This one is also caused, as Joga said, with hormones. But if you eat a normal diet, that is what we call unbalanced diet. That is, you involve a lot of proteins, vegetables, even the starch, and then the fruits. That's a very good diet for you. And that one will make sure that the body can absorb all the things it wants from that. So you can't be specific on calcium, and it is the one going to do it. You might take calcium and find that the body is not absorbing. So it won't help your osteoporosis. So you have to go to the medical doctors, get tested, do this check. What is the problem that you are not absorbing what is necessary for your body? Then when they find that the reason why you are not absorbing, they will give you either a medicine and to make you absorb that particular mineral. And then they tell you what to do, maybe activities to avoid what. But osteoporosis, you have to get the basic concept why it is causing you to have brittle and very thin bones. Diet is okay. You can take anything balanced. It will be okay. Because why we say you don't go saying, my bones are weak, I'm going to take calcium. You might go and take calcium and it boosts something else, which will affect another area of the body. So for you to take calcium, please get your calcium level tested. Magnesium, zinc, all those minerals. You needed to know them, the level according to the body system, for you to decide to take certain supplement for your bone density. Otherwise, it's not something to do with lack of food for osteoporosis.
So we need to be careful taking these
Supplements, yes.
You want to comment on that?
I'm going to add to what Dion was saying. This one is a silent killer is because rightfully so it'll affect the part of the femur that connects to the pelvis. And if you get a fracture there, you can get a blood clot or an embolus that can float into your bloodstream and land in either your lungs, your heart, or your brain. That's how it can kill you.
Yeah.
Wow.
Yeah, that's what's called a silent killer because it affects, because if the bones become spongy and they become brittle and it breaks, especially medically speaking, what they call the neck of the femur, and then you have you have a broken femoral neck, it can cause an embolus, which can land
in the
brain, heart, and your lungs, and it can be fatal. So that's why it's called a silent killer. Yeah. And even with what Dion was saying, even checking your mineral levels, but even too, I also have to add digestion. Is your gut lining able to absorb what you've digested from your stomach to then take it to your bones? Then now you can talk about, check your gut and see if you have a problem with any gastrointestinal problems, because that's where a lot of the absorption of materials happen to go to the tissue that the blood is taking it to. So that also could be a malabsorption or a digestion problem.
Okay.
Yeah.
All right.
And to add to that, it's a good, all these things we are saying we invest in our health, is that if osteoporosis is noticed early, it is manageable.
Yes.
You can manage and you become back to normal life. But if it is discovered very late, breaking of the bones is very easy, as you say, and they cause effect on the circulation system. So it is good to have yourself checked, especially now when you reach that called menopause. Yeah? For men, it comes early, but it is very rare.
Yeah.
Yes.
Are there any signs and symptoms that could tell you, this might not be going very well in terms of bone density and you need to get checked? Do they have any signs and symptoms, or it really is silent?
No, I think if anyone has their regular checkup with their doctors, and obviously depending on when, for women, I guess also too. I guess for me, in my area of experience with chiropractic and nutrition, is when we see, either skin rashes on a person's face or even just any kind of manifestation of someone's not digesting properly, so having gut issues or even diarrhea, or even necessarily being so inflamed. I start to think, I know what it's doing to the joints, but what exactly is happening? What's the why behind the inflammatory process? And so we ask a whole series of questions to ask whether it's a digestive issue, whether it is a circulatory issue, what is it? And then obviously we send them to the medical doctor who actually does the tests and confirms that. And then we start getting to, let's see what it is that you're eating that may be causing the inflammation. What is it you're exposed to, right? That's causing the inflammation. Those are things that we can start with patients when they come to us, so that way when we can project and see down the road, if this is a lady and she's not able to actually absorb many things and digest many things, this is going to be a problem down the road, right? So it's just that's a step above what would be considered someone coming in their 50s or 60s or 70s, and they have early onset of menopause, and then because of early onset of menopause, they are more osteoporotic or have osteopenia. It's pretty much, we meet people where they are when they come to us, but then we also do that investigatory background to see how we can help them. Even it may involve other providers who actually are more skilled in that. That could be that's one way we actually address that. But when someone comes with, oh, I have pain here, I can't walk, and you definitely can see that someone is not bearing weight on their leg.
Okay.
I had a client who had that situation, and she was in her 70s. A lot of things happened in her life, and she could not even put her weight on her right leg. A red flag just went off, and I'm like, she may have a fracture. So we sent her for x-rays of her pelvis, and sure enough, she had a fracture of her neck. And I'm like, you need to go for surgery right away.
Okay.
Yeah.
I find that, what are the signs that you might be having osteoporosis? Most of people, especially let's go towards men, is that they work the whole day. But when they go home or during the day towards the end, they feel a lot of pain around the bones of the rib cage.
Or on the chest.
Around the chest, and especially the outer one.
Yeah.
And it is worse towards the end of the day. Pain, which even if they take painkillers, it doesn't go away. So that is a sign to tell you there's something not right with your bones. Because that way, you must have seen your muscles are okay. But you feel a lot of pain by the end of the day around the chest area, thoracic, so we call it. For women, it is the same thing. When you sit somewhere for too long, you find yourself, you want to straighten yourself up. But the pain is so much, you can't tell it is in the muscles, but you feel it aching in the bones. And the other area is the hips. They say when I walk a distance, I feel so much pain in my hips, I have to sit it down. That is a sign of osteoporosis, early osteoporosis. Yes.
Okay. Yeah, it really is a disease that can slowly creep in.
Yes.
And you start asking a lot of questions. So I think we're done with the week-long bones and joints week. And there you have it, folks. The why, the how, and how you can manage it. And before we close this session, we shall be showing exercises and stretches that you can be doing every morning and every evening to keep your spine healthy. Remember, invest in your spine. So we can start with the last word, Dr. Njogu. Anything that you would like the audience to take away from all this?
Yes. One thing that I see most of the time when patients come to me is that they're in pain. And the pain is a symptom, it's not the problem. What is the symptom is caused by something. Yeah. So don't wait for pain to show up to get it rectified, because by that time it may be too little, too late. If you see any any inability to move the way you used to, and as John was saying, even doing some kind of shrugging or shoulder, and there's tension and there's tightness and there's some discomfort, that should be a telltale sign to get yourself checked. Don't put it off and delay, and then by the time it shows up, it may be too little, too late. So any small hint innately that there's something happening to your body, come and get it checked out.
Don't keep popping those painkillers.
No. They're putting a Band-Aid on the issue. They're just treating symptoms. It's not treating the cause of the symptom.
Okay. All right. Dion?
What I would tell our people is that I know we have done perfect in the medical side, being checked your blood pressure, sugars, and anything medical within ourselves. We have ignored the musculoskeletal plus the joints and the bones checkups. So even if you are done by your medical doctor other tests, please inquire whether what else can I do for bones and joints, even muscles. Get it checked the way you are checking the rest. And the last part is that look for an activity Doesn't matter, it is walking, swimming, running, climbing mountains. Get an activity which will involve your joints, muscles, and the bones. And if there will be any issue, that activity will tell you or show you where your weakness is. So always let's be on our movement. As the saying says, motion.
It's lotion for the spine.
Yes.
So these are exercises that you can do every day, every morning and every evening to keep your spine healthy. They only take 3 minutes and they're very easy exercises. So to begin with, let's learn how to stand properly. So when you're standing, your feet should always be shoulder length apart or a foot apart. And then you feel taller than you already are. That would mean your chest comes out a little bit and your stomach muscles tighten. So always make sure your ear, your shoulders, your hip, and your feet are in a straight line when you are standing properly. So we start with breathing exercises. So we're going to breathe in through the nose and breathe out through the mouth. So let's go. Breathe in and out. Breathe in and out. Breathe in, hold, and out. Then we start with a fast posture. Yes, so we are going to have, we tilt alongside our sides and go as far down as we can go until where you're comfortable without bending forward or backwards, and hold it there for 3, 2, 1. We started with the right side, so we move on to the left side. Go as far as you can go alongside your body. Hold it there for 3, 2, 1. One more set to the right. Go as far alongside your body as you can. Hold it there for 3, 2, 1. Left side again. Hold it there for 3, 2, 1. Okay. And then now we're going to tilt without moving our feet. The only thing that is moving is the spine. And then twist as far as you can go until you can see. We started with the right, so until you can see what was on the left. Hold it there for 3, 2, 1. And twist now to your left. Twist as far as you can go. Hold it there for 3, 2, 1. Okay, twist again. Hold it there for 3, 2, 1. And the last side, hold it there for 3, 2, 1. Okay? And then we are now going to get our right elbow meeting with the left knee and vice versa. So we're going to do 10 counts. So in this particular case, your back needs to remain straight. Do not bend your back. So let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And still with your hands there, we are going to have this motion. Yes, because a lot of us sit for very long and our chest muscles are tight. We're going to have this motion. It's as if you want your shoulder blades to touch. So the movement is backwards, right? And then you can make it a bit more fun and move to the right, a bit of a dance. You move to the right. Yeah, hold it there for a while. And move to the left. Good. Hold it there for a while. Move to the right again. Yes, we're opening up our chest muscles and move to the left again. Right? So now we can concentrate on the neck for just a little while. So try and get your right ear to the right shoulder without having to, what is it called? Do this to your shoulder. So it's the ear getting to the right shoulder and you hold it there for 3, 2, 1. You can have the help of your hand. Hold it there for 3, 2, 1. And then turn completely until your chin and your shoulder are on the same level. And hold it there for 3, 2, 1. Turn completely again until your chin and your shoulder are on the same level. hold it there for 3, 2, 1, then turn again. And this time around, once the chin and the shoulder are at the same level, turn to look at the chin. So it's a different muscle group being activated, and hold it there for 3, 2, 1, right? Same thing again. Once the shoulder and the chin are in the same line, you turn to look up. Hold it there for 3, 2, 1. This other side. When the chin and the shoulder are on the same level, turn to look at your armpits and hold it there for 3, 2, 1. Right, back to where the chin and the shoulder are on the same level, and then turn to look up. So a different muscle group is being activated. Hold it there for 3, 2, 1. Alright, so now we can move to the lower limbs. And one leg. Start with this. So both feet are pointing in the same direction and they are on a tight rope on the same level. So we are going with our back straight. So the leg that is behind, you straighten the knee and you push forward until you can feel a stretch at the groin, and you hold it there for 3, 2, 1. And then this other leg as well, right? So they should be almost in a straight line. Do not bend the knee of the leg that is behind, and stretch forward as far as it can go, and hold it there for 3, 2, 1. Okay? And then the other one is touch your toes without bending the knees. Touch your toes and hold it there for 3, 2, 1. Go a bit further without bending the knees and touch the floor and hold it there for 3, 2, 1. If you're more flexible, get the whole palm on the floor and hold it there for 3, 2, 1. Okay? So now shake your right hand, shake the left hand, shake the right foot, shake the left foot, shake them all, shake them all, shake them all, shake them all. And go back to the standing position where your feet are 1 foot apart and you're standing tall. When you stand tall, your stomach muscles engage and they are tight. So you breathe in and out. Breathe in and out. Breathe in. So there you have it, folks. We cannot emphasize enough. Invest in your spine and have those annual checkups. Make sure your spine, your muscles, and the general wellness of your bones and joints is checked annually. I have been your host. My name is Nelly Ndiga. Do have a lovely evening.